So once again, it is my great pleasure to be here and to give some of the background for our activities for this conference, for what we're doing. What do we mean by enhancing research, development, and education for health and longevity? What we mean is that we try to address the main cause of disability, of disease, of mortality, which is the aging process itself. We know that with age, all disease increase in prevalence, in mortality, in severity. And what this means is that the aging process itself is the main risk factor or the main underlying cause. That sounds trivial, but the implications are not trivial at all. This means that we have to address aging as a medical condition. We have to know how to diagnose it, we have to know how to treat it, we have to know how to evaluate the effectiveness of treatments. That's the main idea of geroscience, or of health and longevity medicine, and also the longevity movement that we represent. And the idea should have been clear during COVID time, when we saw that all the persons are the most vulnerable, simply because of the underlying aging process. So the conclusion should have been that we have to improve the aging health, the health of all the people, also to combat aging, to combat COVID. But this wasn't the conclusion that was made. The conclusion was that people had to be isolated, even ostracized. But now hopefully the COVID subsided, but still the major diseases of old age remain: heart diseases, cancers, neurodegenerative disease, metabolic disease, and to prevent all of them, we need to intervene into the aging processes. That's our main point of advocacy, and of course, in advocating for the medical intervention to aging, we advocate not just for the general life extension, which is also valuable. If we value life, we want to prolong it, but also healthy life extension, the increase of healthy longevity, of healthy lifespan. The situation of Israel is not so bad in this regard. The general life expectancy is about 82 years, and the healthy life expectancy is 71, but that was in the time of COVID. That's the latest data available from WHO. Now we hear that the life expectancy in Israel jumped to the 4th place in the world, to about 84 years. And we don't yet know the healthy life expectancy, but usually it's about 9-10 years less. So we're in a good place in the world. And in some countries with lower life expectancy, I recommend that people sound the alarm and increase the effort for healthy life expectancy, to close the gap. Here in Israel, I say let's build on what we have, let's strengthen our position, let's move to the first place. So we have all the ingredients for that. But generally, our advocacy here and around the world is that we have to increase healthy life expectancy. That's the real solution for the aging challenge. And it is possible, it is feasible to increase healthy life expectancy, to intervene into aging processes. There are several major classifications of aging processes, such as the pillars of aging, the hallmarks of aging. For each major aging process, they are shown the possibility of intervention in animal models and also some emerging human trials. It is our goal, not just as health professionals or health researchers, also our goal as public advocates, of activists, even to help move these therapies from a fundamental stage, from the bench, not to say to the clinic, but to prevent the clinic, from the bench to the people, to prevent as much health-related, aging-related disease as possible. And it is not possible to intervene into aging or to treat aging if we don't know how to measure it, if we don't know how to diagnose it. That's why it is very important that hand in hand with developing therapies, we also develop so-called biomarkers of aging or metrics of aging. Here in our work with my colleague, Dr. David Bloch, and others, we introduce some of the metrics based on information theory. I will not go into this, but generally our goal, not just to advance our project or our research, our goal is to encourage the conversation about the metrics of aging. On the one hand, to predict aging-related ill health, which is a necessary condition for preventive therapy for age-related disease, and on the other hand, to evaluate the effectiveness of treatments that we have to measure. On the one hand, to prevent snake oil treatments, so I can say that water can prolong your life indefinitely, but we have to measure, we have to be able to predict it with certainty, and also to encourage the treatments that actually work, that actually helpful. So that is why development metrics is very important, not just as a scientific task, but also as a policy task. Treatment of aging is completely unregulated, So we have to develop metrics that will be able to not to regulate for the regulation's sake, but to be able to encourage the treatments that work and curb the treatments that don't work. And of course, we don't forget the healthy lifestyle education, all the things that we know and not always do, because we are lazy sometimes, but all the things that we should do, like sufficient rest and sleep, and exercise, moderate and balanced nutrition, and of course the motivation for life. Very important, probably more important than all the other three elements combined. To have a motivation, something to get up in the morning, to have a vision, to have a mission in life under any condition, even during the war. We promoted health and longevity. Even though it was far from everybody's agenda, we still continue to promote it. Very important, because wars start and end, but health and longevity will remain valid forever. And of course, side by side or hand in hand with promoting healthy lifestyle, we have to promote advanced biomedical science. Some people believe that only healthy lifestyle is sufficient. No, it's not sufficient, if only for the simple reason that for many older persons, we don't know how personalized therapy, how to produce treatments that will be effective for them specifically, not as a bulk, and for that you need research. And we also need research to develop therapies that are maybe more far-reaching, more effective than what we have right now with healthy lifestyle. So we have to develop both lifestyle and advanced biomedical research. And it is very important to emphasize also here in this interdisciplinary research unit in the Department of Science, Technology and Society that we advance health and longevity not just to increase and prolong the pleasures of the flesh, but also to develop as human beings. Because health and longevity correlates pretty much with every human value, with valuation of life, with peacefulness, with economic prosperity, with education, even with justice and equality. If we want to advance those values, we have to advance health and longevity as a proxy, as a driver. So if people ask, why do we focus on longevity? That's why. Because if we promote health and longevity, if we succeed that people live long and healthier, almost by default, we'll have all the other values promoted. And one of the major values is just the economic value. If we are able to extend health and longevity just by 1 year, we can save billions and sometimes trillions in the healthcare welfare system. For example, it was calculated that for a large country like the United States, an increase of healthy life expectancy by 1 year can save hundreds of billions of dollars. And for a smaller country like Israel, it will be over $1 billion. There was a special calculation done for our Vetek association by Dan Olshansky group from the University of South California, the people who actually came up with the longevity dividend model. The longevity dividend calculation that they did for the United States, they did for us. And it turned out a rough calculation could be improved probably, but the rough calculation that by extending healthy life by 1 year in Israel will save at least $1.5 billion or at least 5 billion shekels for the healthcare welfare system. And that's just direct savings. That's just from people not getting sick, not getting disability pensions. But there are also indirect benefits, such as extended period of productivity, developing biomedical industry, creating competitive edge for Israel, creating collaboration. The savings, the indirect savings could come to billions of dollars more. So it's very important also for the public health reasons, for the public survival reason, I would even say, to promote health and longevity. And that's what we do. That's, I'm a researcher. I have over 80 academic papers and 2 books, but what we do in our associations, Vetek Association, the Movement for Longevity, international associations, the International Longevity Alliance, is that we promote this kind of vision, this kind of advocacy, awareness about the importance of aging research. I don't care if my research gets funding. We hope to achieve funding for the entire field because it's critical for the survival as a society, as a nation. And we operate in the usual methods of public advocacy, of public activism, by getting people together, organizing meetings, organizing conferences, even demonstrations. In 2023, 5 days before Israel was attacked, we organized an international demonstration, a series of demonstrations in a dozen countries for health and longevity. So we act like activists for every purpose, because once again, if you have a social value you want to promote, you don't just sit and wait until it arrives. You go after it, you promote it, you educate for it. So that's what we also do for health and longevity. And a critical element is community building. Getting people together, like-minded people. For example, in our International Longevity Alliance, we now gathered 75 non-profit associations working in 65 countries with branches. So what we do is we actually encourage each other. The value of the community is encourage each other. Together we can achieve much more than each one individually. So once again, we promote the field through publications. Soon there will be published a book on health and longevity policies and practices, advocating, first of all, developing, then advocating for specific policies to advance both healthy lifestyle and biomedical industry for longevity. There are some other projects like another book, and also recently we published had accepted a paper on good practices in health and longevity medicine. So it is also very important to lay down the policy foundations for health and longevity. Once again, this is not just a scientific issue, a medical issue. This is a public issue and an issue of public interest. And there are some results of this advocacy. Just two examples, very short. I still have a few minutes. One is the recognition of aging as a medical condition. We started this movement in 2012 here in Israel. We wrote a petition to all the members of the Knesset asking to recognize aging as a treatable medical condition. Everybody said, yes, it's all correct, aging is very important, but don't call aging a disease. Okay, let's call it something else. So we continue our advocacy to recognize aging as a treatable condition. And now, thanks to our advocacy, International Longevity Alliance, some of the petitions we submit to WHO, aging is recognized as a medical condition in the ICD, in ICD 11, not as a disease, but as two types of category, as first of all as a symptomatic category, the so-called aging-related decline in intrinsic capacity, and second is aging-related code, which is in the etiology or causality category. So basically, right now, physicians can diagnose and treat aging according to the ICD. Why aren't we doing this? Because we once again don't have a reliable metrics. We don't have a clear metrics how we can evaluate the process, how we can evaluate the intervention. That's a major obstacle for implementing this code. But at least the code is there thanks to advocacy. Mainly thanks to advocacy. I'm not saying only us, but we definitely contributed. And also we contributed to the movement to include aging into the WHO work program in 2017. Can you imagine, aging wasn't recognized as a problem by the WHO? Was in the work program, so hundreds of scientists, hundreds of organizations wrote to them and demanded this included, so it was included. So these are two examples of successful advocacy for health and longevity research, development, education, for policy for health and longevity. So you can see just from these two examples, yes, as also Alex mentioned, yes, advocacy works, activism works. And I hope we will extend our effort, increase our effort, so also more support is given to health and longevity research and education. And practically, we focus our advocacy here in Israel. Still, most of the support programs, most of the funding programs of research programs are at the national level. So we focus our advocacy at the national level. And what we achieved is, for example, together once again with Alex, with Hanan, we introduced the subject of health and longevity research, development, and education to the Israel National Master Plan on Aging that was published by Knesset in 2019. Nobody remembers because we had 7 elections in 5 years and COVID and war, so people had other priorities, but it's still there. It's in the National Master Plan on Aging. To improve research, development, education for health and longevity, which is why also the title of this conference, to remind people about this program. And practically what we achieved is to simply bring funding for aging research. I'm very proud to say that in a large measure, I would say carefully, the large measure, thanks to our advocacy, a lot of funding was encouraged mainly from the Ministry of Science, starting from our first conference in Bar Ilan 2014, from the first program, the so-called Scientific and Technological Infrastructure for the third generation. For 10 years, there were about $28 million, about 90 million shekels allocated for aging research. Also, thanks to the ministries, thanks to their recognition, but also thanks to our contribution. I'm happy to take credit, thanks to the explaining, to the dedication of decision makers, and I hope we continue. Even this year, during the war, during massive budget cuts, about 10 million shekels were allocated to aging research, about 8.5 million from the Ministry of Science, by inclusion into the national call for proposals, about 1.5 million from the Ministry of Health for aging research specifically. And also very proud that also our advocacy contributed to making this realization. Once again, not taking credit, but I'm saying encouraged. And I hope we can encourage in the future also with everybody's support. And that's why we're also holding this conference, raising awareness and hopefully building up the movement for health and longevity. And this movement can be scaled up to any dimensions. The subject is relevant for everybody, for every nation, not just for Israel, and any nation cannot do it alone without international cooperation. That's why international cooperation is key. Iris here represents BIREX Aging, Britain, Israel Research and Academic Exchange Partnership on Aging, a great program where also was happy to contribute and cooperate with. But a similar program can be established with the Czech Republic. Here we have a representative of the Czech embassy. With China, we have representatives of China. With Germany, with any place in the world. I just came back from a series of conferences, international conferences that the Vetek Association co-organized in Porto, Portugal, in Geneva, Switzerland, and also in Riga, Latvia, and in Vilnius, Lithuania. That Alex also mentioned. In Lithuania, we had it in the Lithuanian parliament. And we hope we can encourage real, not just European, but international cooperation together with Israel for health longevity as a common task, as a common coordination and support action. And I hope we succeed for the benefit of all of us. And once again, it's very important to hold conferences, to bring people together, to raise awareness. And thank you very much for being here. To be truthful, to be honest, I'm not sure if we have this conference next year in Israel. Depending on our funding, maybe yes, maybe no, maybe in 2027. But at least we'll continue our advocacy, our activism, and also we'll continue working internationally. I already invite you to a conference we once again co-organize in Lithuania, in Vilnius, next June. In the Lithuanian parliament, in other locations, in the academy. You know, once people called Vilnius Jerusalem that is in Lithuania, Yerushalayim Shebelita. So we're holding conference there. And also we'll have a conference in Frankfurt in October, but that will be a Baron's talk. I will not steal his announcement, but we'll continue international collaboration, our international promotion. So once again, thank you very much for being here, for supporting us, and let's keep working together. Thank you.